Welcome to Healthyho. Friends, today we will be talking about palpitations, or commonly referred to as ghabrahat. So what is this ghabrahat or palpitations which is perceived by many of the children? This is essentially the fast beating of the heart rate. Whenever we feel our own heartbeat which is beating fast, we call it palpitations in medical terminology. What are the causes of palpitations? Are these palpitations really always ominous? No. Palpitations are something which is very much natural in few of the patients as they grow. Why these palpitations are happening? We know our heartbeat is constantly beating. The heart is constantly beating. But once we perceive that it is beating faster, this is what the palpitations is. And they get exaggerated by certain situations like hormonal changes, like whenever you have a hemoglobin level which is changing. So these are some of the important, whenever there is a fluid shift inside the body. So these are very common to have palpitations. So very important, particularly in growing up children where the hormonal shifts are maximum. That is the age when they maximally present with palpitations. But should we always neglect these palpitations? No. Few of these palpitations could be an indication of underlying heart disease. Few of these palpitations can point towards certain abnormal tracts in the children. Are these tracts and heart diseases very risky? No. Whenever we have abnormal tracts in the heart, that means we have a normal pathway where there is a battery in the heart and there is a conduction tissue, the wiring inside the heart which pumps the heart. But in few children, there can be abnormal wiring which is additionally pumping the heart and which is perceived as palpitations. If the palpitations are because of these abnormal tracts, your doctor will first get a ECG done. The ECG will tell a snapshot of the heartbeat, that is that particular time how the heartbeat is behaving. Few of the indicators that there is an abnormal tract will come out from that heartbeat. The second test which a doctor will advise will be a Holter test. Holter test is a continuous recording of this ECG for next 24, 48, 72 hours depending on how long the doctor wants to evaluate the rhythm. And then he will analyze how the heart is beating. In case there is an evidence of abnormal tract, these children can easily be treated with one small simple procedure which is called electrophysiological study and RF ablation. Electrophysiological study is the angiography where we go inside the heart, check the beating of the heart rate, see for abnormal tracts and burn that abnormal tract with RF ablation. Once you treat it, it is treated for life. So it is important that these things are picked up appropriately. So whenever you have a palpitation, don't neglect it. Most of the time it will not be very ominous. Most of the time it will be because all the factors which we have discussed. Few cases may have an abnormal tract which also can be treated without surgery with an angiography which is absolutely safe. This is not like the angiography which we do for adults. It is a small nick, a small wire which goes inside the heart, checks the heartbeat and burns it. And once treated, these are treated for life. So it's always important with palpitations, consult your pediatric cardiologist for a condition which is easily treatable.